Hello everyone, in today's video we will show how to achieve a laparoscopic Roux-en-Y gastric bypass with the gastrojejunostomy hand sewn. As always, we will begin by taking down the angle of His. The gastrophrenic ligament is lysed with the help of an energy device to straighten the sharp angle of the stomach. A window is created in the lesser omentum near the incisura to allow insertion of a linear stapler. The first fire is made at right angle to the longitudinal axis of the stomach, and subsequent fires follow parallel to the long axis. In this way, a snug gastric pouch is created. In some patients, the omentum is too thick to just slide away, as was the case in this patient, hence we take it down. After locating the DJ junction, we measure the Roux loop. It is brought up to the stomach pouch and stitched to hold it in place. Now we will proceed to perform a totally hand-sewn gastrojejunostomy. This, although slower than staplers, allows for a better control with lesser chances of bleeding and leakage. We can see that a successful gastrojejunostomy can be achieved even without the use of staplers. The gastrojejunostomy is performed in two layers. First, the serosa of both stomach and jejunum are stitched together. Then, enterotomies are created, which allows the jejunum to be joined with the stomach. And finally, the enterotomies are oversewn. Here we can see an enterotomy being made in the stomach, and a corresponding enterotomy is made in the jejunum. They are sewn together to create the gastrojejunostomy. Small bites are taken to ensure a watertight anastomosis. If any bleeding is encountered, it is sealed with the help of the energy device. The gastrojejunostomy is being oversewn right now. The jejunum is transected at an appropriate point and a jejunojejunostomy is made to complete the Y configuration of the Roux-en-Y gastric bypass. We will use a stapler for this and close the openings with a suture. In the end, stitches are taken in the mesentery to close the pseudo-Peterson space and the Peterson space to avoid any internal herniation. Here we closed the pseudo-Peterson space. And here we are closing the Peterson space. With this, we conclude laparoscopic Roux-en-Y gastric bypass surgery.